The International Virtual E-Hospital Foundation is a non-profit organization with its headquarters in Austin, Texas. IVeH was created to assist in rebuilding the public healthcare system in developing countries by introducing and implementing telemedicine, telehealth, and virtual education programs through the concept of the IVeH network. IVeH is managed solely by its volunteers and governed by an international board of directors. Our vision is to transform healthcare and medical education worldwide through telemedicine and advanced medical technologies. Our mission is to create and establish self-sustainable telemedicine and e-health programs around the world and to rebuild medical systems in the developing world, one country at a time, using telemedicine, advanced technologies, cultural exchanges, and collaborations as a platform. Since its establishment in 2001, IVeH has worked diligently on establishing integrated telemedicine networks and virtual education network in the Balkans through a strategy that we have named Initiate, Build, Operate, Transfer. The IBOT approach has been successfully implemented in Kosovo and Albania. It has been published in the peer-reviewed press in numerous books and book chapters, as well as in many international conferences. Since July 2012, IVeH is using the IBOT approach to implement the integrated telemedicine and e-health program for the Republic of Cape Verde. The initiation of a program at a country level normally is done through an intensive telemedicine e-health training program and a capacity assessment. To date, 5 intensive Balkan telemedicine and e-health training seminars have taken place, as well as an international congress of telemedicine and e-health. The first intensive training seminar took place in Pristina in 2002. Over 400 representatives of Kosovo healthcare system attended the 2-day program. The seminar launched the Kosovo telemedicine program that is today considered one of the best examples of telemedicine programs in the developing countries. The second seminar took place in Tirana in October 2007. It was followed by a country telemedicine assessment conducted on May till June 2008 and the USAID-funded integrated telemedicine and e-health program for Albania that started on September 2009. The third and fourth seminars were organized respectively on Skopje, Macedonia in February 2009 and Podgorica, Montenegro in November 2010. The fifth seminar was organized in the context of the first International Congress of Telemedicine and e-health that was held in Pristina to mark the 10th anniversary of the Balkan Telemedicine Program.
Telemjekësia përbën një potencial të jashtëzakonshëm, të ri, në ndihmë të jetës së të smurve.
The Congress was recognized as an official activity of the International Society for Telemedicine and e-health, as well as of the American Telemedicine Association. It gathered participants from all over Balkan and Europe, as well as speakers from all of the 5 continents, some of them present and some of them telepresent. The International Virtual E-Hospital was supported by the European Union and the United States Department of State to implement the Balkan Telemedicine Program. This program was implemented through structured intensive training, educational curricula development, and exchange programs for physicians, nurses, and technical professionals from Kosovo, Montenegro, Macedonia, and Albania. In Kosovo, an integrated infrastructure was deployed in 7 telemedicine centers, 1 national center in Pristina, and 6 regional centers in each of the communes of the Republic of Kosovo. The program offers possibilities to conduct teleconsultation between Pristina and the regions, as well as between Kosovo and international healthcare providers, to organize a virtual education program targeted to doctors and nurses, as well as to promote research through the electronic virtual library. The Balkan Telemedicine Program created a powerful international medical education network in the Balkans for further collaborations and development. The medical and technical leadership created provided a solid foundation for new changes in healthcare in the Balkans. This multi-institutional, multi-state, and multi-country program represented a comprehensive educational undertaking involving telemedicine and telehealth, trauma, emergency management, and surgical critical care. By creating new opportunities for partnerships between medical institutions from the region with renowned institutions in the USA, this program became a true ambassador of medical advances, cultural diversity, and advances in technology. In addition, the program improved the integration of the IVeH network into interregional and international activities using technological advances and virtual communications. This project is managed by an international virtual team and was completed in the fall of 2008. The participants partook in intensive training programs at the Arizona Telemedicine Program, the University Medical Center in Tucson, and the Alaska Federal Healthcare Access Network in Anchorage, Alaska. Since establishment, the virtual education program has been the cornerstone of the telemedicine program of Kosovo. 3,000 nurses received qualification certificates following an exclusively virtual education program that encompassed regular lecture and seminars. During 2012 and 2013, the telemedicine program of Kosovo organizes weekly lectures that are broadcasted throughout the Kosovo and Albania telemedicine network. Thousands of credits are awarded to attendees from both countries. The Integrated Telemedicine e-Health Program of Albania started on September 2009, founded by USAID Albania. The United States Army Corps of Engineers supports the program through renovating the premises where telemedicine centers are located. As of September 2013, 9 telemedicine centers are established and renovated, 3 at the national level and 6 at the regional level, covering with telemedicine service almost 80% of the country population. A telemedicine leadership development program taking place in Albania, the United States, Kosovo, and Montenegro took place since the beginning of the program, and it is still continuing with regular conferences, seminars, and hands-on workshops. The clinical telemedicine program focused on several priority areas identified in collaboration with the clinical services of the Tirana University Hospital Center. The teletrauma program was the focus of the second phase of the telemedicine project taking place between 2011 and 2013. It has recently established a regular structure providing real-time teleconsultations for all trauma cases needing neurosurgical care. A clinical teleophthalmology program took place during 2012 till 2013 as a collaboration between the Tirana University Hospital and the Galway University Hospital in Ireland.
Yes, I'm optimistic that she'll do well with surgery. There may be a slight difference in the height of the lids after the surgery, but she should be significantly improved.
Children affected by eye ptosis were diagnosed via telemedicine, were operated in the country and subsequently followed up by using telemedicine techniques. Since 2012, the Psychiatry Service of the Tirana University Hospital and the Regional Autism Center collaborate with experts from Autism Speaks to diagnose and treat children affected by autism in Albania.
Okay, now when she counts 1, 2, 3, 4, then put the, make sure the 4 is there and say how many, and she says 4, and then prompt her to take the 4 and put it at the 4th block.
In parallel, the telemedicine program is used as a tool to train and develop the national capacities. The telestroke program continues since 2011. 3 conferences, namely Telestroke 1, 2, and 3, were organized in collaboration with the neurosurgery and neurology services of the Tirana University Hospital. On December 2012, the Minister of Health issued an order that all stroke cases fulfilling certain criteria should be teleconsulted prior to referral towards tertiary services. Distinguished experts have shared their experience with the Albanian counterparts, such as the well-known British neurosurgeon Professor Henry Marsh. Other telemedicine programs such as telediabetes, teledermatology, teleradiology, and telepathology are on the way. The telemedicine and e-health network of Albania is now an integral part of many international training and experience sharing networks. The International Trauma Teleground Round, hosted by the University of Miami, the radiology webinar organized by the Università degli Studi Piemonte Orientale, Avogadro in Italy, the telemedicine program of Kosovo lecture series, etc. are just some of the examples. Since 2 years, the integrated telemedicine program of Albania is experimenting live surgery, broadcasting, and recently the infrastructure that enables in it regular basis is installed at the surgical rooms at the National Trauma Center. The next station for implementing integrated telemedicine e-health programs using the IBOT approach is the island nation of Cape Verde. IVeH is collaborating with the health authorities of this 9-island country since July 2012. The Ministry of Foreign Affairs of the Republic of Slovenia is funding the effort through the non-governmental organization ITF Enhancing Human Security. A national conference was organized in October 2012 to launch the program.
We understand that there are very pressing healthcare needs throughout the entire country.
It really is a happy occasion for us because we're seeing the fruits of years of labor and investments paying off, not just for Albania, but for other countries as well.
Është një program I cili tashmë ka një histori në Shqipëri. Është një arritje për ne, ka shumë për të bërë, për ta vënë në zbatim atë që kemi investuar, por ne jemi shumë të kënaqur që këtë eksperiencë ta ndajmë edhe me kolegë në Shqipëri, në rajon, edhe në vende të tjera të cilët kanë interes të zbatojnë projekte të tilla.
Over 200 healthcare professionals from the main island of Santiago attended. In the following months, another 250 to 300 healthcare professionals from other islands have received training in telemedicine and e-health. 6 senior representatives attended a leadership development program in Pristina in December 2012, whereas 2 groups of 15 representatives each attended the leadership development program in Albania and Kosovo in April 2013. From December 2012 till June 2013, 2 national and 8 regional telemedicine centers have been established in Cape Verde, covering all the 9 islands. Each of the centers is equipped with video conferencing and telemedicine equipment, as well as with a number of computers for the electronic virtual library. The International Virtual Lecture Series started in September 2013. Every week, 1 lecture targeting either doctors or nurses is delivered from USA, Portugal, Albania, or other countries to the Cape Verdean virtual audience. In parallel, the clinical programs of telecardiology, teledermatology, teleradiology, telegynecology, telepsychiatry, and teletrauma have started or are in the process of starting up. The clinical telemedicine units are equipped with e-stethoscopes, ECG, dermatology cameras, ultrasound probes, vital sign monitors, and general examination cameras. They enable real-time teleconsultations between the islands of the 2 country tertiary hospitals in the main islands of Santiago and San Vicente. The programs of teledermatology, telecardiology, and teletrauma have already conducted the first teleconsultations. A very intensive program is focused on mother and child health. The gynecology department of the tertiary hospital Agostinho Neto is collaborating with health centers in the nearby islands to launch a cervical cancer screening program. The pilot program is expected to start in November 2013. IVeH has been presented in the scientific peer review press, as well as in many national and international congresses, conferences, seminars, and workshops. Many articles in peer-reviewed journals, book chapters are dedicated to the accomplishments of IVeH in different countries as well as at the international level. In May 2011, IVeH presented its Kosovo work at the American Telemedicine Association Congress in Miami. Our presentation on cost effectiveness of telemedicine represents one of the few original research work in this field, demonstrating that telemedicine and e-health are not only effective but efficient as well. In April 2013, two presentations from IVeH were presented at the MedETel 2013, the largest European telemedicine congress hosted annually by the International Society for Telemedicine and e-Health, respectively presenting the teleophthalmology program and the integrated program as whole. Several demonstrations from Albania and Kosovo have taken place, such as the ones during the USAID organized ASEAN Rural Connectivity Conference for Education and Development in Hanoi, Vietnam. The Balkan Telemedicine Program and the Cape Verde Program have attracted significant media attention. Tens of press articles, TV and radio interviews have represented the program to audiences in Kosovo, Albania, Macedonia, Montenegro, and more recently Cape Verde. Professor Rifat Latifi, the president of IVeH and director of the Balkan Telemedicine Program, as well as the director of the Integrated Telemedicine e-Health Program in Albania and Cape Verde, is regular speaker at the Albanian language program of the Voice of America.
Programi telemedicins është vetëm një pikë, një oazë e vogël e suksesit të shëndetësisë edhe në Kosovë dhe në Shqipëri, por veçanërisht në Shqipëri. Ne kemi bërë disa suksese të jashtëzakonshme, sidomos në aspektin klinik, siç është për shembull teletrauma ose përdorimi i traumë i telemedicinsë për raste traumatologjike, pastaj për lëndimet tjera ndryshme edhe oftalmologji.
The Kosovo and Albania and Cape Verde press follows attentively and represents any accomplishments of the respective telemedicine e-health programs. Now, IVeH is trying to use our rich experience in several countries for expanding our work and implementing similar programs in other countries. IVeH has signed or is in the process of signing memorandums of understanding with governments in Macedonia, Montenegro, Tanzania, Comoro Islands, Sao Tome and Principe. Governments and organizations in Moldova, Armenia, and Nigeria have also approached us with requests of collaboration. The work of IVeH in establishing telemedicine e-health program around the world has also attracted the attention of other organizations. In June 2011, the Computer World Honor Program awarded their 21st Century Achievement Award in Health Sector to IVeH and Professor Rifat Latifi, with the motivation for the successful elaboration and implementation of the IBOT approach and the Balkan Telemedicine Program.
Accepting the award in health is the president and founder of the International Virtual E-Hospital, Dr. Rafit Latifi.
When we started telemedicine in the Balkans, we did it out of desperation because people were dying because of lack of information.
The same year, in December 2011, URAC and the Care Continuum Alliance awarded to IVeH their International Health Promotion Award in the category of International Community Health. These programs represent some of the best ideas in community and workplace health promotion, said URAC President and CEO Alan Spielman. Care Continuum Alliance President and CEO Tracy Moorhead added, their commitment to population health and the experiences they shared will accelerate the spread of the best practices and spark continued innovation and health promotion.